Good morning, everybody. Good to see you all. I want to thank you all for joining us on our first press briefing for Girls Empowerment Network. My name is Luisa Suarez, the Chief Program Officer at Girls Empowerment Network. Today, I'm here to speak on an urgent issue impacting youth success: the lack of funding for mental health support in Texas public schools. In 2025, the ABAS found that U.S. students are facing serious challenges, where 37% of students reported to poor mental health and 44% of them reported feeling persistent sadness. Without adequate resources, students are left without the mental health support they need to stay healthy, succeed academically, and feel safe. As new legislation is considered, it's critical that we prioritize funding for school based mental health services to protect youth and their future. We have been working since 1996 advocating for youth in Texas public schools to promote their self efficacy, meaning they believe in their ability to succeed by teaching mental health resources and skills to thrive in and out of the classroom. The process of introducing this curriculum is shared with approximately 15 Texas schools each semester. Our facilitators work closely with school staff, social workers, students themselves to assess their mental health state. The curriculum is designed to help youth build confidence through personal and social development. Models range from internal growth topics like self compassion to interpersonal skills such as healthy relationships. Through these lessons, students improve their sense of agency, coping skills, and work to see themselves as capable of facing challenges both in and out of school. In 2024, over 1,200 students completed our curriculum, with 84% of them reporting improved coping skills and 90% of participants advanced to the next grade level on time. These results show that when schools are able to collaborate with trained community mental health providers, students benefit academically, emotionally, and socially. However, these programs require funding. Ensuring schools are financially equipped to sustain these partnerships is essential to meeting students' mental health needs statewide. It is important for organizations like ours to contribute data, insights, and youth voices to shape legislative decisions. Our staff testifies at the Capitol, sharing their on-the-ground experience supporting students, while our Spark the Change Day program brings young people to learn how to advocate for themselves, testify, and speak directly to lawmakers about the challenges they face. Girls Empowerment Network is committed to expanding its missions by supporting SB 649, which will create a dedicated funding stream for mental health and behavioral services in Texas public schools. This bill aims to ensure schools have the financial resources to provide professional support, train staff, and partner with community providers such as our organization to meet student needs. A 2025 study by the National Institute of Mental Health found that 30% of teens experience severe anxiety, with 80% untreated. The 2024 School Mental Health Report Card revealed that 20% of youth had a major depressive episode, and 56% of them didn't receive treatment. These numbers reflect a crisis. Without proper funding, schools are unable to meet students' basic mental health needs. Behind every statistic is a student struggling, and that is why fundamental health in public schools matters. As an organization in frequent contact with youth, we hear firsthand how urgent this issue is. It's become normal for students to wait weeks for help with academic or mental health struggles. During Spark Change Day, an event designed to inspire youth to develop their voice as advocates, one of the girls in our program shared her story while visiting Senator's office at the Capitol. This individual explained that in her school it often took weeks to see a counselor. In Texas, the current student to counselor ratio is approximately 1 to 400, while the ASCA recommends 1 to 250. She said, I remember needing help and being told I had to wait 3 weeks. By then, my grades had dropped and I was barely getting out of bed. I didn't feel like anybody was there. Girls Empowerment Network gave her a space to be heard and supported, but as a time limited school program, schools need additional funding to ensure students have access to full time mental health staff. You deserve someone full time in their schools who is trained and ready to help. Your story is just one example of why the lack of funding for mental health in public schools is a crisis that cannot be ignored. We urge lawmakers, education leaders, and community partners to support dedicated funding for mental health and behavioral health services in Texas public schools. Programs like ours show what is possible, but we cannot be the only source to support students. Thank you again for being here today and for listening to the voices of youth, staff, and advocates. Students need consistent, accessible mental health support in their place they spend most of their times, their schools. We ask you to help us elevate this conversation, cover this story, share these realities, and be a part of the movement that helps Texas youth succeed. Thank you.